Manual techniques are external forces applied with the hands to the chest wall to facilitate airway clearance. They are an appropriate treatment option when the patient is either too unwell or cognitively not capable of cooperating with more active airway clearance strategies. This technique can be performed by health professionals or family members. Before commencing this treatment, check for any precautions or contraindications. If bronchodilators have been prescribed, administer them before commencing treatment. The patient can be in any position which will assist with ventilation and the drainage of sputum from the lungs. The position most commonly used is side lying. For all of the techniques, position the patient comfortably and safely and watch the face at all times for signs of dyspnea, cyanosis, or an increase in work of breathing. Percussion, also known as clapping, is performed with cupped hands and involves the rhythmical flexion and extension of the wrists onto the chest wall at a rate and pressure that is comfortable for the patient. Care must be taken to percuss only over the lungs and to place a towel or thin layer of clothing over the area to be treated. The patient may be instructed to do tidal volume breaths or sets of thoracic expansion exercises during percussion, followed by breathing control. Chest vibrations are the manual application of fine oscillatory movements of high frequency with chest compression to the rib cage. The therapist places their hands on the chest, either one hand on top of the other or side by side, depending on the size of the chest wall. The patient is instructed to take slow, deep breaths. As they breathe out, a rapid oscillatory movement is applied in the direction of the normal movement of the ribs and is transmitted through the chest using body weight. This is thought to enhance the effect of airflow on the movement of secretions. Shaking is performed in the same manner as vibrations, but as a coarse movement. The oscillations are of a larger amplitude and lower frequency than vibrations. Vibrations and shaking should not be uncomfortable, as any discomfort will inhibit expiration and airflow. The choice between vibrations or shaking may depend on the age and health status of the patient and the clinical experience of the therapist. A session of manual techniques may vary from 5 to 15 minutes depending on the clinical condition of the patient. Secretions are cleared using the forced expiration technique and coughing following each session.